Faith leaders all across Indiana are urging lawmakers to fully fund a mental health crisis response system here in our state.
It's Senate Bill 1, and it already passed the Senate, and now it's headed to the House. But paying for it is what brought the pastors to the State House today. Jenny Runovich joins us now live tonight with the message that they hope to get out. Jenny?
Well, Scott and Ann, church leaders spent the entire day today talking with lawmakers here, and they say it's not enough to just voice support for mental health help. They say the budget has to pay for it completely.
And we are here today in support of SB 1.
Out of the pulpit and into the public forum, pastors with the Black Church Coalition are making their case for money for mental health crisis response in Indiana. Clergy now calling on lawmakers to fully fund Senate Bill 1, not just pass it, but pay for it.
The whole $130 million worth, right?
But in order for us to have services and support, places to call and places to go for residents across the state of Indiana, that bill must be fully funded.
It's personal to Dr. Carlos Perkins. He sees the struggle for mental health services in his church members, in his own family.
My brother, at 17 years old, had a psychotic episode, had a mental health break, and never recovered. We've been, as a family, struggling with this over the last 12 years.
And he says a lack of crisis services can lead to deadly results.
One of the things that has motivated us is the case of Herman Whitfield. And that family has now had to go through, over the last year, the pain of losing a son because he had a mental health crisis and they called the police.
Senate Bill 1 would make sure trained professionals help families in need. It would boost the 988 crisis hotline and pay for mobile crisis counseling units to respond 24/7. Lawmakers so far have discussed spending around $30 million on SB 1. Faith leaders say that's not nearly enough and say without fully funding the bill, it's just a piece of paper.
It's great to say that you're in support of something. It's great to say that it's a good idea. It's another entirely to take the next step and fund those and fully support them.
So right now, Senate Bill 1 is in a House committee, and at least one study says if this bill is fully funded, it could actually save the state about $4 billion a year in untreated mental health costs.